Welcome to The Mix, where we explore and discuss topics in different sectors. And I'm your host, Nes Nurenda. In our first episode, we are kicking off with an important member of the healthcare team, a medical assistant. Joining me today is Mrs. Wana Selamiti, who is going to take us through her experience, challenges, advancements, and success in her field. With 9 years of experience, Mrs. Wana Selamiti offers a wealth of knowledge on the daily operations of a medical assistant. So let's jump right into it. What led you to become a medical assistant? Is that something that you've always dreamed of doing?
Not really, but then it was one of those things that maybe I wanted to be a doctor. When I was young, I would say I wanted to be a doctor. But growing up, I didn't really see myself becoming a doctor because I had other visions, like becoming an economist and whatnot. But then um, later on in life, after I wrote my Form 4 exams, I was applying to different colleges, and then it just happened that I got selected into Malawi College of Health Sciences to pursue a certificate in clinical medicine. So it could be one of those dreams that were hidden, and I just got lucky and blessed that I got to go study clinical medicine. But I really couldn't get into the doctorate part. But then, yeah, it was part of it. It was partly my dream.
Okay, so as a medical assistant, what are the qualifications that are there that people who wants to be a medical assistant should have?
They need to do well in their sciences. That's biology, physics, chemistry, um, what else? Mathematics, yeah, English as well. So it's either with being a medical assistant, you have to at least get 2 credits of the sciences and at least a pass.
Yeah.
So those are the qualifications to become a medical assistant. But you really need to work hard on your with the science subjects.
So if someone has a passion in humanities subjects, but then they also want to be a doctor or a medical assistant, is there no another chance for them to be a medical assistant?
No, because those are the qualifications. You need to do well in your sciences.
Okay, so you have only talked about the MSc. Talked about the MSc level. What are the schools that are there that a person can go to so that they can go and get their medical assistant degree or diploma?
A medical assistant does not have a diploma or a degree. Being a medical assistant, it simply means that you got a certificate in clinical medicine.
Mm-hmm.
But if you want to become more than a medical assistant, you become a clinical officer. It simply means that you get a diploma in clinical medicine. There are degree courses that are offered. I think they recently introduced one in Malawi. It should be Malamulo College of Health Sciences, but then I'm not really sure. But you can study clinical medicine. You can get a degree in clinical medicine outside the country. But then in Malawi, if you want to pursue further, if you have a diploma in clinical medicine, it simply means that you have to go get a degree, a bachelor's at KUHES. You can either do medicine, you can do pediatrics, obs and gyn, or else you can go start year 1 of MBBS. So, yeah, in Malawi, those are the things that we're supposed to be doing to pursue further than being a medical assistant.
Okay. Okay, so how do you manage time and tasks in such a busy environment? I mean, you're a medical assistant, so you prescribe a lot of drugs for different patients. So how do you manage time?
My time. I have to get to work at 7:30. So I start working at 7:30, and sometimes I can break at 10, but usually we don't really enjoy our breaks because it's just a client after client, patient after patient, and we take our time off around 12 if it's no longer busy, and then we continue with our day. We knock off at 4:30. So it's with my personal time, I can say I do my personal stuff after work or before work, sure, and during the weekends.
So, do you have any memorable event that happened between you and a patient, that a certain patient came at your place and then you really connected with the person, like you were, trying to help, but then you connected them?
Yeah, I have those kind of scenarios, and there are a lot of them, but I remember specifically one.
Yeah.
We had this other child when I was working in Chill. I was allocated in minor theater, and this one child came with an injury. Um, he got a very big cut from a bicycle. So he was going home from school. So when he got on the bike, apparently there was some accident that happened, and then he came to the minor theater. It was around 4 when we were about to knock off. So I helped the little boy. The mother came, and later on, after 7 days, the wound had an infection.
Okay.
So we managed this child because he almost lost his heel because of the infection. So I tried to consult some of my friends, my colleagues, and then we tried to debride the wound, and we used to see this child almost twice a week until the wound completely healed. And during this process is whereby I connected with the mom, I connected with the boy, and I'm still in touch with them, both of them. And this boy has never forgotten me. And this time around, he was in nursery school, and right now I think he should be in standard 7 or 8. So during that phase, it should be a month, because I think we treated him for about a month and a half. I really connected with them. So yeah, we have those kind of scenarios, and I have that particular patient who I connected so much with.
So, what led to the connection between you and the boy?
What led to the connection?
Yes.
I guess it should be how I treated them both. I treated the mom, I treated the boy, as well as the fact that he almost lost his heel. Because we were busy talking about it, and the mom was there. We're like, I think maybe we should just remove the heel, maybe it will heal. And then so the fact that maybe we tried to save this boy's heel, so that he can be able to function properly. I think that made the mom connect more, and she just felt the sense of kuti, that we helped a lot. So that's how I think that's what happened for us to connect.
How do you handle difficult or emotional situations with patients?
Being a medical assistant, you have to be empathetic. You have to be in the patient's shoes. You have to be in the guardian's shoes as well. Like, you have to understand what they're going through. So sometimes you have your own emotions. Sometimes they might come with their own emotions. They might be hoping for something better than maybe what you might offer. So in every situation, you have to stay calm, and you have to listen to whatever they're saying. Don't shout back, and also always try to understand what they're trying to communicate, or what they're expecting from you. So handling of emotions is all about staying calm, and that has worked for me throughout the years.
Okay, so you said it's an SDA health center, right? So are there any specific rules that I applied Zabu Church, and then at the same time Zibagila Sogu Zaushipata?
Not really. The only rule that I might say is that on Fridays we don't go for around 12, just to prepare for the Sabbath, since it's a Seventh-day Adventist clinic. So, and Saturdays it's closed, but it's still open for maternity women that are coming to deliver. So it kind of I think that's the only rule that is there. Yeah, that is there. But it's not really also a rule. It's just that we just abide by the doctrines of the church. Yeah.
How do you collaborate with doctors, nurses when you are trying to prescribe medicines for patients?
When you're prescribing, it's all about teamwork. You need to understand that you can't really work at a hospital facility alone.
Yeah.
So I am a medical assistant. I offer primary healthcare. So I need to see the patient first. If I have to prescribe, I'll prescribe there and then they'll go to a pharmacy, get their drugs, go home. If it's case that has been that is more complicated, I have to refer it to secondary healthcare system. So I need to assess the patient, give them the first management, and then they have to be referred to a secondary healthcare system. So it's all about I see the patient first, and then if there is anything else, they have to go to maybe a rural hospital or a district hospital. There they will meet doctors or clinical officers, so the patient will be well taken care of. And the only way I can communicate with my fellow colleagues is by writing in the health passport, the patient's health passport. So I have to make sure that I clearly put in the medical history, the family history, my examinations, whatever I have found, and then my management, so that they can start from where I stopped. So that's how we communicate mostly. Yeah.
Oh yeah, I guess there's no need for me to ask this question anyway. You talked about teamwork, right?
Mhm.
So here, writing the proper drugs in a health passport, I think you call it that, in a health passport. So I think that's part of effective communication,
Yes,
right?
exactly.
So I guess there's no need for that. Or what are some of the biggest challenges that you face as a medical assistant?
There are a lot. You look at your clients sometimes, understanding. Sometimes it's hard for them to really understand the importance of getting access to proper medical attention. So it's either when you want to refer them to maybe to a rural hospital or district hospital, sometimes they don't have money. You really have to explain to them, and then some understand, some don't really understand the importance of going to the rural hospital. They want you to help them at a primary healthcare system, and that is just not doable. And some of the things are maybe lack of some other equipment at a health center, because we don't really have everything for diagnosis to diagnose a patient. So we rely on the referral system, and also the referral system is it's a bit difficult sometimes when you're referring clients from one facility to another, because maybe sometimes they don't have transport, and now you really know that this patient won't really get the help that they need at the health center, but they'll get all the attention, maybe all the treatment at a higher level. But yet the system is a bit, it delays in getting clients from a health center to a rural hospital or to a district hospital or to a central hospital. So those are one of the most difficult parts of being in a primary healthcare setting, where you tend to see clients worrying about going to the other level, and there's nothing much you can really do about it.
Should I really get into the equipment part? I feel like that's too personal, right? Like the equipment part.
The equipment part is not really personal, but then the equipment part is not really personal, but then as someone that is working in the health system, someone that is working in the health system, some of the necessary equipment that are supposed to be there at primary health care, they are not really there. So it's just beyond me and maybe most medical assistants. But then all we can ask for is maybe either the government or the institution that is running that particular clinic to always ensure that they have enough supplies. for primary healthcare, so that people can get all the equipment or all the treatment that is needed at the primary healthcare level. So yeah, I would say it's beyond me. It's beyond me.
Yeah, true. But then on, a personal opinion, right? Do you think Kuri, other primary health centers don't have those kind of equipment? And do you think Kuri, it's the government's fault, Kuri, they don't have such kind of equipment?
On a personal opinion, most health centers do not have enough resources or enough equipment. I'm not really sure if it's the government's fault, but then I would say that maybe the government should just look at the health system or the health system in general, so that they can pay attention to it, and also mostly pay attention to the primary healthcare system mostly, because this is where you see all the patients. This is where you start seeing everyone, like everyone reports to a health center first before they go to the district hospital, and that is how it's advised. We see a lot of people that are in remote areas, rural areas, they fail to go, as I'm saying, they fail to go to district hospitals, rural hospitals, because of the distance.
Yeah.
So it's really important if the government ensured that more equipment like more attention is being paid to the primary healthcare system.
So, how do you stay motivated?
Being motivated is all about loving what you do. So I love what I do. I go to work every day and I love being there. I love helping. If I help to my best capabilities, then that's fine with me. I stay motivated by looking at a client and seeing them get better, walk home. They go back and then you meet them one time, they'll be like, hi, I'm much better now.
true.
That you're like, oh, okay, I helped. This time around, I helped. You cannot really help everyone,
Yeah,
but then I stay motivated because I love what I do. That's what keeps me going. I love what I do. If I wanted to further my studies, then I would have to either apply for a diploma program at Malawi College of Health Sciences or Malamulo College of Health Sciences to pursue a diploma in clinical medicine. If I wanted to go further with that, and then I would apply, as I said at first, that you have to apply to KUHES. You can do orthopedics, you can do pediatrics, you can do medicine, you can do surgery, you can do obs and gyne. You can also apply to some of the private colleges that are there. You can apply for a public health degree. So opportunities are there to further your studies if you're a medical assistant.
With technology, a lot of things are changing, right? So, how do you stay updated with the new technologies that are coming in your field?
Mostly it's the trainings that are conducted.
Yeah.
So if something new comes in, let's say we usually use EMR system, that is electronic mastercard system. So if there's anything new, they have to call us for training so that we can be updated. Sometimes you see some, nowadays the world is more advanced in most
true.
things. So you can see some other things maybe on the internet, you get updates from the internet. But most of the times if there's a new guideline, maybe a substitution of any drug in terms of maybe malaria, HIV program, TB program, it means we have to be updated with the training. So we are trained to the new guidelines of that particular thing and how we are going to manage it. So medicine is advancing. The drugs that we are using are no longer the drugs that people were using back then. So we do that with these trainings. We get updated with these trainings. We can use the internet, as I said. We have guidelines. We have clinical books that are available on the internet, as well as the hard copies.
Okay, so I don't know if this is appropriate. But there was this other moment our lecturer was like, all the medicines that come in Malawi, there are.
As I said. So I would tell someone to go ahead and pursue to become a medical assistant if they really wanted it. But it's one of the jobs that if you need to want to become a medical assistant, because there are times whereby you are posted to maybe a really rural area, and then you need to have that sense of wanting to help. Yeah.
Okay, so how has this career of a medical assistant impacted your personal life? Kids in those particular countries like China, there are kids doing practical things. So it's those medicines that they send qua developed countries like Malawi.
Not really, but then there are drugs whereby there are some drugs that are really expensive that Malawi cannot really afford.
Yeah.
So Malawi is a developing
Yeah.
country, and most of the drugs that we depend on, sometimes we just donated, sometimes we buy, but then we can't really buy the expensive ones. I would give an example of the ARVs that we are using in Malawi. It's different from the ones that are being used in developed countries. So it's what we can manage. It's not necessarily that it's we're getting the lower class, the what, but it's what we can manage
As a country.
as a country. It's what we can manage.
That's just so sad.
Mm.
Anyway. But okay, what advice would you give to someone considering a career in medical assistant?
It's one of the most fascinating jobs. If you love helping people, it's nice. You get to connect with different cultures, because after school you don't work where you stay. So
Yeah.
you travel, you go connect with different people, you learn. And also as a medical assistant, if you're given a health facility, you become a leader. You naturally become a leader, and you learn how to manage a facility, and you gain leadership skills. Apart from helping, apart from prescribing the drugs, they train you how to lead others. They train you how to manage a particular clinic, like a clinic. So you are the overall boss at a particular clinic, and that is just amazing, because
Yeah.
it simply means that you add some skills in your life.
Yeah.
So if anybody wanted to pursue or to become a medical assistant, I would say they should give it a go ahead. It's where life starts. I know most people say it's low, because we are below clinical officers, we are below doctors, but then you are the one who first meet the patient, and it helps you even grow more in your knowledge or your clinical skills, because now you have to think critically on how you're going to help this particular person, so that they may survive at that particular moment. So it's one of it's one of the challenging jobs, and also it's nice, it's exciting, as I said. So I would tell someone to go ahead and pursue to become a medical assistant if they really wanted it. But it's one of the jobs that if you need to want to become a medical assistant, because there are times whereby you are posted to maybe a really rural area, and then you need to have that sense of wanting to help. Wanted it. But it's one of the jobs that if you need to want to become a medical assistant, because there are times whereby you are posted to maybe a really rural area, and then you need to have that sense of wanting to help.
Okay, so how has this career of a medical assistant impacted your personal life? Personally, how has it impacted you?
As one would want to, if I would encourage someone to become a medical assistant.
Yeah.
Personally, I have learned how to be patient. Of course, I'm a patient person already.
Yeah.
But then it taught me to be patient. It taught me to listen more. It taught me to lead, to become a leader in life.
Yeah.
Not only in clinical setting, but also in my life. I've learned how to manage things in my life, and it has just been an eye-opening job, and it also gave me. I'm already an interpersonal person, but then I'm a people's person. But then it also taught me to be kind to everyone, because you tend to meet all groups of people.
Yeah, true.
Whether they have money, they don't have money, and it makes you to become even more empathetic, to understand how life is going. So it has really taught me a lot, and I'm really grateful for it.
Okay, is there anything that you wish people knew more about medical assistant?
Maybe I would say we are the real deal.
Okay.
We are the real deal because we work day night.
Yeah.
When you're working at a health center facility, you work you wake up in the morning, you have to work.
Yeah.
In the afternoon, you have to work. If there's an emergency at night, they have to wake you up.
Yeah.
So we are heroes on our own, I
Yeah,
believe,
true.
because we are there for the patient at the rural setting where there's no other person that has to help them.
Help
So
them.
we are there to help first. So we are the real deal. I would say we are the real deal.
Real deal.
Yeah.
Go for it. So, what do you hope to achieve in your career?
Currently, it's a bit complicated.
Yeah.
Because I've been a medical assistant for, I think it should be 9 years now, if I'm not wrong. Yeah, it should be 9 years. And over the 9 years, I want to pursue my studies further. So I joined a program, a public health program. If I'm done with that, sometimes I think of doing orthopedics. So maybe to help still, I want to be around patients.
Yeah.
So I might do an orthopedic diploma later on. So currently I'm doing a bachelor's in public health.
That's all for today's episode of The Mix. A huge thank you to Mrs. Iwana Salamiti for sharing her experience with us. You were with me, Nes Nyuenda.